Hello, my name is Georgina Ramos, and my presentation will be over Factitious Disorder, analyzing the Series C Act, which is over Gypsy Rose and Dee Dee Blanchard's case. What is factitious disorder? According to our book, it is a disorder in which a person feigns or induces physical symptoms, typically for the purpose of assuming the role of a sick person. Munchausen syndrome was known as factitious disorder, derived from the exploits of Baron von Munchausen, an 18th-century cavalry officer who journeyed from tavern to tavern in Europe, telling fantastical tales about his supposed military adventures. Malingering is known for an individual to be known to have one intentionally feigning illness to achieve some external gain. It can also be to avoid work or responsibility, taking drugs, avoiding law, or seeking attention. So, according to American Psychiatric Association, these are the differences between fictitious disorder imposed on self and fictitious disorder imposed on another. So on self, it is false creation of physical psychological symptoms or deceptive projection of injury or disease. Presentation of oneself as ill or damaged or hurt. On another, it is false creation of physical symptoms or deceptive projection of injury or disease in another person. And the presentation of another person, victim, as ill, damaged, or hurt. It is also known as Munchausen syndrome by proxy, which is very known for the caretaker or parent to make up or produce false illnesses in their children that sometimes leads to painful tests, medication, and surgery. So in the act, it shows a fictionalized version of the story of Gypsy Rose and her mother Dee Dee Blanchard. It is a case about Dee Dee Blanchard being a single mother to Gypsy Rose, who made everyone believe, including Gypsy, that she was ill with many medical issues. So I included these two pictures that on the left are the actors from the series The Act, and on the right is the picture of the real Gypsy Rose and her mother Dee Dee Blanchard. So, according to this Journal of Clinical Psychology in Medical Settings, some of the signs and symptoms with someone with fictitious disorder imposed on another is by a form of abuse by creating false disorder symptoms in a child or even adult. It involves exaggeration, simulation, fabrication, and inducement of physical or psychiatric illness. A medical report of the case by Domina Patrick says that Dee Dee Blanchard showed these signs and symptoms by saying that Gypsy suffered from leukemia, asthma, muscular dystrophy, and had the mental capacity of a 7-year-old due to a brain damage she had suffered as a result of her premature birth. Since she was known of muscular dystrophy, she was bound to her wheelchair, and she was also known to have sleep apnea, epilepsy, and hearing and vision impairment, which was all false by her mother. So, some convincing ways that Dee Dee Blanchard made Gypsy Rose seem sick. She pretty much devotes her time to Gypsy and her medical issues. She's the one who does all the talking with the doctors and speaks for Gypsy. I included one of the pictures from the series The Act, and it shows right here where Gypsy Rose is pretty much like being quiet and listening to her mother talk to the doctor and pretty much taking over her case. Um, Didi was also familiar with enough medical terms because she used to be a nurse's aide, so she was able to convince the doctors and pretty much people because she knew what she was talking about. She will feed Gypsy through a feeding tube, which is shown right here in this picture, and was also convinced she could not have any sugar, which because she was allergic, which was not true. Um, Dee Dee convinced people to donate and for charities to help her out, and it will be making everyone to believe how ill her daughter was, and people will reach out to help them out any way they could. So, what are the outcomes and how they were affected? So pretty much Dee Dee Blanchard, she becomes more possessive and abusive over Gypsy's life. I included one of the pictures of one of the episodes in the act where it shows where Dee Dee has this closet of full medication, um, and it also pushes Gypsy to start questioning her mom's actions, and I think it is also due to her getting older. Um, so Gypsy also later on meets up with her boyfriend, whose name is Nick Godejohn, and she met him online, and did constant video calls and phone calls and texts, and she pretty much like vents to him about the treatment from her mother. So both of them start to plan a how to murder her mother and run away together. After Dee Dee was killed by Nick Godejohn and pretty much runs away with Gypsy to his house, they were later on tracked by the police and got arrested. So Nick Godejohn is serving his life sentence, and Gypsy Rose, although she did not kill her mother, she was pleaded guilty to her murder and was sentenced to 10 years in prison. But she was later on released just last year in December 2023. And I also included a picture from one of the episodes in the act where Gypsy is about to leave her house after Nick murdered her mother. And also there's a picture of when she was sentenced to 10 years in prison. Developmental factors. So according to Bass and Halligan, there's a study of 20 patients with factitious disorder who suffered a childhood illness, and more than half suffered a childhood loss. The illness behavior are multifactorial and dependent on a person's previous illness history, family influences, developmental factors, and present beliefs about illness and resources. In one of the episodes of the act, Dee Dee Blanchard's mother, which is Gypsy Rose's grandmother, um, it goes back to the day where Gypsy was a baby, and her grandma undermines Dee Dee's parental role and questions the way she takes care of Gypsy. Um, and it also shows how Dee Dee um, writes bad checks and does shoplifting, and Gypsy's grandma tells her how bad of a parent she's being and how she's being a criminal. And Dee Dee calls her out saying, well, you taught me that. You were the one who showed me how to do this. So it pretty much like kind of like shows how it came for Dee Dee to develop this disorder because of her mother and how she was raised and how she was questioned of her parental role. So she pretty much came very like obsessed with her daughter's health. So this is how she became to develop this factitious disorder imposed on another. So some treatments and therapy. The Journal of Clinical Psychology in Medical Settings states that there is a model called ACCEPTS that is proposed as treatment when it comes to factitious disorder imposed on another. So for ACE, it means acknowledge. It is the most important treatment goal to acknowledge and take responsibility for inappropriate behaviors that harmed or could be harm to the child. C will be coping. It is the second component of treatment, includes the goal of developing a wider range of effective coping strategies to manage personal emotional needs. will be for empathy. It is the third component of treatment, includes the goal of developing the ability to empathize with the child's victims. This requires that the abuser and spouse or partner experience an appropriate emotional response to the harm and suffering that the child victim or victims should experience or could have experienced as a result of the abuser's past maladaptive behaviors. P, it means for parenting. It is the development of appropriate parenting skills, and it is extremely important. This treatment component includes the recognition and ability to make decisions with the priority that the child's needs come before the needs of the abuser. T means taking charge. So many abusers report feeling disempowered and taking power or control indirectly through the gaining attention or nurturance from health professionals by having a sick or disabled child. So this goal of therapy is designed to help the abuser recognize her power and utilize it appropriately. S means for support. It includes strengthening the relationship between the parents, cultivating and improving the utility of the available social support network, utilizing professionals for ongoing assistance. If the abuser and spouse or partner have been able to successfully move through the initial phases of treatment, they may engage in couples or parenting therapy together and move forward integrating with the children. It is recommended that the individual therapy also continue during this process. And this concludes my presentation. Thank you.